Hi, my name is Julia Kehoe, and I'm going to talk to you about aflatoxins today. So, mycotoxins are the term that designates the toxic secondary metabolites produced by microscopic fungi that have been demonstrated to cause a range of serious adverse health effects in animals and humans. Mycotoxins likely evolved as a type of chemical defense for the fungi. There are nearly 400 known mycotoxins, but the five most prominent naturally occurring mycotoxins in human foods and animal feeds are aflatoxin, ochratoxin, deoxynivalenol, zearalenone, and fumonisin. I'm going to focus on the aflatoxins as they are the most thoroughly studied and behind which there is epidemiological evidence of the adverse health outcomes behind exposure to them. Of the 17 compounds designated as aflatoxins, the term generally refers to the four compounds of the metabolites produced by Aspergillus flavus and Aspergillus parasiticus. They are named B1, B2, G1, and G2, where B and G indicate that the aflatoxin fluoresces blue or green when exposed to UV rays, and B2 and G2 are the dihydro derivatives of their parent compound, so they have two more hydrogen atoms than B1 and G1. Of the four major aflatoxins, B1 is found in the highest concentrations and is the most potent. Additionally, mycotoxins can occur in meat and milk from animals consuming contaminated feed, where the aflatoxins are designated by the letter M for milk. Here we can see the chemical structure of the four main aflatoxins. They're highly oxygenated heterocyclic compounds. These toxins are chemically stable and tend to survive storage and processing, which is a property that definitely increases the opportunities for exposure. The fungi that produce aflatoxins are ubiquitous and opportunities for exposure are widespread. Exposure occurs primarily through the ingestion of contaminated foods. Aflatoxins are common contaminants of maize, groundnuts, legumes, and tree nuts, in addition to other foods and animal feeds. Exposure can also occur through inhalation or dermal exposure. The occurrence and magnitude of aflatoxin contamination varies with geographical and seasonal factors, in addition to the conditions under which crops are grown, harvested, and stored. Crops in tropical areas are much more susceptible to contamination than those in temperate regions because fungal growth is optimal in areas of high temperature and humidity. Furthermore, crops that have undergone insect damage or other damage are more prone to infection by toxin-producing fungi. In developing countries where rural communities are lacking a diverse diet and are dependent on staple foods such as maize, nuts, and legumes, there's an increased risk for exposure and consequently a much higher number of affected individuals in these developing countries. Of course, susceptibility varies by sex, age, health, nutrition, environmental stress, the level and duration of exposure, and the presence of a hepatitis B virus infection, which I will come back to later. So, chronic exposure of humans to low levels of aflatoxins occurs more frequently than acute toxic exposure. Acute aflatoxicosis can cause liver disease, Ray's syndrome, vomiting, abdominal pain, edema, hemorrhage, and death, whereas chronic symptoms can involve hepatocellular cancer, fibrosis and cirrhosis, and immunosuppression. Because aflatoxins, especially B1, have been demonstrated to be potent carcinogens in some animals, a lot of study recently has focused on the effects of long-term exposure to low levels of aflatoxins on humans. These studies have generally supported an association between dietary aflatoxin intake and the incidence of hepatocellular carcinoma, or HCC. It is generally accepted that most chemical carcinogens act through a genotoxic mechanism, of which DNA is the main target, and aflatoxins are no exception. Most carcinogens require metabolic conversion into reactive electrophiles, which then bind to the nucleophilic DNA bases. These DNA adducts have mutagenic tendencies. Aflatoxin B1 is activated in the presence of the cytochrome P450 to form an unstable 8,9 exoepoxide, which then links to the N7 position on the guanine nucleotide, forming the adduct that can be potentially carcinogenic, and serves as the biomarker for exposure to the carcinogen. These DNA adducts can result in GC to AT transversions, a mutation specifically at codon 249 of the p53 tumor suppressor gene, which likely contributes to the development of the cancer. Due to these properties, aflatoxin B1 is described as the most potent known natural carcinogen. Aflatoxin B1 has been demonstrated to be highly co-carcinogenic with the hepatitis B virus, or HBV. For individuals chronically infected with HBV, aflatoxin consumption raises the risk of liver cancer up to 30 times compared with either exposure alone. Currently, HCC is the third leading cause of cancer deaths around the world. 4.6 to 28.2% of those new cases each year may potentially be attributed to aflatoxin B1 exposure. This large range is due to uncertainty and variability in cancer potency factors, as well as a high incidence of HBV in areas where aflatoxin B1 exposure is also high. Currently, most cases of aflatoxin B1 attributed HCC are occurring in sub-Saharan Africa, Southeast Asia, and China, where climate conditions are ideal for fungal growth and where populations suffer from both high HBV prevalence and largely uncontrolled aflatoxin contamination of staple foods. One study I looked at was investigating the effects of aflatoxin exposure on human reproduction. So they noticed that the rate of infertility in Western Nigeria was much higher than the global rate. So they wanted to see if aflatoxin exposure, so aflatoxins present in the body fluids of the infertile men in the region, might somehow be related to that infertility rate. And so they took blood samples and semen samples from 30 infertile men and 25 fertile men. And so they analyzed the blood for aflatoxin levels, and then they looked at the semen for sperm count, motility, morphology, semen volume, pH, and viscosity. And their results showed statistically significant higher levels of aflatoxins in the infertile group's body fluids. The semen also showed severe deviation from normal in sperm count, morphology, and motility when compared with the World Health Organization standard. So they concluded that aflatoxins probably negatively impact fertility, but that more studies need to be done to really investigate the mechanism. Aflatoxin contamination poses an especially problematic threat because, due to the aforementioned stability of the toxins, ordinary cooking and processing practice don't eliminate the toxin. The use of pesticides and of careful drying and storing procedures can reduce fungal infestation and consequently diminish aflatoxin contamination. And also a simple inspection of foods where aflatoxin is a visible contaminant would definitely help. But as these practices will not guarantee total protection from contamination, other techniques for detoxification have been developed. For example, Ultipraz, an anti-schistosomal drug, can decrease the metabolism of aflatoxin B1 to its carcinogenic form and increase the detoxification pathways of its metabolites. Additionally, chlorophyllin, a mixture of chlorophyll derivatives used as a food colorant and over-the-counter medicine, has been shown to be an effective inhibitor of aflatoxin hepatocarcinogenesis by reducing the levels of aflatoxin DNA adducts. Clearly, a serious adverse health effects have been associated and demonstrated resulting from aflatoxin exposure. Increased education and awareness around both the proactive and the reactive strategies would serve to greatly benefit the populations of the world that are most vulnerable to